Finicky. There we are. Okay, perfect. So here, I'll go ahead and share. All right. So, David, I have a silly little theme song that I do. Do you want to hear it?
Sure, yeah, let's hear it.
This is the Nosh Schmooze theme song. It's Nosh Schmooze, Nosh Schmooze, where we talk about cool stuff concerning the Jews and everybody else. So, welcome everybody to Nosh Schmooze. We're really glad that you could join us today. And we're thrilled today to have with us respiratory therapist David Moses discussing the life of a hospital worker in a pandemic and what you can do to keep them and you safe. And as always, if you have questions or comments for David, please leave them in the comment section in Facebook and I will field them to him. But first, a bit about David. David Moses has been a registered respiratory therapist for close to 17 years in the Orlando area. He currently works in hospital administration, but also has his position as a respiratory therapist so that he is still able to provide direct patient care, which is his true passion. David is from Coral Springs, Florida, and relocated to Orlando to attend the University of Central Florida, where he obtained both his bachelor's degree in cardiopulmonary sciences and a master's of science degree in health service administration. Welcome to the show, David. And it's
Thank you. Hi, thanks for having
me. we're really so happy to have you here. And first off, I just want to thank you from the entire Temple Bethel of Hollywood family for the incredible work that you do, which is more important now, I think, than ever in our lifetime. And my first question for you, I'm curious, what made you want to become a respiratory therapist?
So I originally, when I was in high school, I used to work at an animal hospital, and that whole field and aspect of caring, doing care for, it was animals at the time, made me realize that was what I wanted to do. I wanted to do something in healthcare with people. In high school, working at an animal hospital, was a good job to have for a high school student. And then I came to college at UCF, not really sure what I wanted to do. And then I took a course called Introduction to Allied Health Professions, where you learned about different health careers, lab technologists, phlebotomy, physical therapists, athletic trainers. And when they did the presentation about respiratory therapy, I had never heard of respiratory therapists before, and I was definitely intrigued. And I went and I met with the director of the program and found out what I needed to do to apply, and changed my major my fourth year of school, and spent an extra 2 years to get my degree. But it was worth it because it's really what I had finally figured out what I wanted to do and where I wanted to be. So it was worth it. And I realized, how intense of a profession it is, and it definitely got my attention. So
yeah, it's funny you mentioned working at the animal hospital. I feel like I have so many memories of you wearing scrubs. and, and that's part of it. I can say I've known you pretty much my entire life, give or take 1 or 2 years. And I think it's fair to say that Judaism has probably impacted your life. And I'm curious, has being Jewish affected your career choice?
No, I don't think so. I really don't think so. I make sure that I'm off, for the holidays, and Coral Springs is only 3 hours away. So of course I want to be with my family, and I'm close enough that is doable, So no, I don't think it's really affected much. I'm always the department's go-to for who's going to work on Christmas, which is good because that means I'm always off for Thanksgiving, and that's something my family does celebrate. We don't celebrate Christmas, obviously. So no, I've always kind of been like the one Jewish person in my department. And, but no, as far as the career and the profession itself, no, I don't think it's really affected much.
Do you think, like, I
So,
often think about the Jewish value of pikuach nefesh, which means like to save a life, and how that takes precedence over, pretty much anything else.
yes, that's a good point. My cousin, I have a cousin that lives in Israel, and I remember him saying like the fact, even if you, as long as I can help extend a life, that it's a huge mitzvah. Every breath that I give anybody, even if it's their last breath, is um, a huge mitzvah. And that is a good point that you bring up. Yeah.
Hmm.
Yeah.
I love that.
Yeah.
So how is your job in hospital administration, and as a respiratory therapist different since the beginning of the pandemic?
There are a lot of differences. So I guess, in it's coming into administration as a clinician. I definitely felt like I had some upper hands knowing, the clinical side in order to provide the administrative side. And that's definite. um, but since COVID started, the admin side is it's a lot different in that, everything we're doing and trying to procure equipment and expanding, the hospital wards, doubling the size, moving out of the traditional hospital unit into alternative areas to accommodate for surge capacity. And being a part of that planning is, almost unheard of before COVID, and again, having a clinical foundation has been helpful with the logistics and the functionality of trying to do all of that. Um, and then we, in it as administrators, there's a lot of focus on, this is the positivity rate. These are how many people are tested. These are how many people are positive, and, tracking those kinds of numbers. And like I was telling you before the interview, at the bedside, when I go to take care of patients and work at the bedside, working with the therapists that are doing it day in and day out. And, things are just so different. There are stations for your own PPE, your personal protective equipment that you keep in your brown bag, and there's shelving with everybody's names. They've added shelving. I know outside of the ICU where I work, they've taken over the waiting area with all the equipment and the protective, equipment for the staff, because they generally don't allow visitors, so it's kind of like organized chaos in a lot of ways, and um, as things have progressed, as we've learned more about the pandemic and the treatment and, all these things, even from the beginning of the pandemic, things are a little different now. But I was, when I go to work at my other hospital at the bedside, and I'll say like, well, what do you guys think about these statistics, because that's something as an administrator we look at, and they look at me like, we don't look at that. We come in, we're here, we do our job, and it's a lot of work. I have to say, there are days where it's been very, very busy. Unlike really anything I've experienced as a therapist. Just intense. A lot of sick patients that need your attention and need you to focus, and a lot more than just the routine care that we provide. And a lot of rapid response calls and things where patients need that urgent care quickly in a hospital, without going into too much detail. But yeah, I mean, these are definitely some of the sickest patients I've seen as a clinician and as a therapist. A lot of times I think back to the H1N1 pandemic. I think when the swine flu was going around, and how intense that was, and that was pretty intense. But this is definitely a lot more intense than that experience as a clinician. But I really have to give it. I'm here. I've had days where I've worked on a Sunday, and it's been 12 hours nonstop working with the team that I work with, and they do that day in and day out. And then I come to work on a Monday, and I'm behind a desk, and they're still out there, taking care of these patients. So it's impressive. I do see both sides as an administrator and as a clinician. but the people who are really doing the frontline care day in and day out. I mean, we're so many months into this now, and it goes up and down. You know, it waxes, it wanes. We get a surge, it calms down. We get another surge. You know, we're in a surge right now, but it's very different than normal times, I guess you could say. And I think everybody's looking forward to some relief. You know, hopefully around the corner. You know,
Yeah,
so
maybe so. Can you hear us on? And
yeah.
you know, you've spoken a little bit about the morale of the staff and how wonderful the therapists are. I imagine that in terms of the patients as well, this is a different kind of stress level. This is a different kind of emotional response that you would see in patients as well as the staff. Are you finding that?
Yes, I'm glad you brought that up because I mean, I did have a patient one time a couple months ago who she was admitted into the hospital and she lost a family member in the same hospital, you know, and it's like she's not unique, you know, and it's very sad, it's very unfortunate, and everybody is so affected by the pandemic, you know, and whether you're frontline staff directly caring for patients or you have concerns about your family members and if I go to the store, is that a smart decision? Am I being safe? Am I being careful enough? Am I going to make my family sick? And is sending my kids to school the right decision? Is that safe? And we all internalize, it's affecting everybody differently, but we're all affected, and I think everybody internalizes it in a similar way. I'm just gonna sip of water, sorry. But I've learned, anxiety is very real, and it's, we all feel physical effects, and it's not uncommon. And this is something I'm experiencing for the first time in my life, that, I'm anxious about this and working and my job and my family and we all, the more I talk to other people, whether they're in healthcare or not, whether they have children or not, everybody is internalizing and taking in, the stress, and, it's affecting us differently, but it's affecting us all, and it's something I realize, that we're all kind of in this together. We're all feeling the effects, and it's important to find an outlet and find, activities, or, I think people are going out more, they're finding things to do, or, certain things are reopening, whether it's restaurants or, people want to go for outside seating, and we're no longer kind of confined to our homes anymore as much. But I think some people still are, confining themselves to their home. But, any distractions and any kind of outlet for the anxiety and the stress has been, for me, has been helpful, even if it's something simple, like doing something for yourself, or buying yourself dessert once in a while, just the smallest things make a big difference, and or finding a friend to talk to. And I think we've all realized, distance is a much, we have friends all over the world, or we have friends down the street that we couldn't see, but we had to rely on technology to do like Zoom calls or, group chats, and people are distancing themselves in each other's patios or driveways, and it's like we're getting creative, and you just want that human interaction, but you don't have to be next door or down the street. You could be, it's any of your friends you could connect with virtually, or, so that's been helpful for me, I know, personally. So
yeah, I've also found that I've been connecting with friends and like seeing their faces via Zoom that I haven't seen in years, because now we have this excuse to do it, and that's
right.
and also just that Florida is not on lockdown right now, but like my friends in California, they are on lockdown.
California is, yeah, even outdoor dining is suspended right now.
Yeah.
So
So,
yep.
On that note, I'm curious, what can we as non-medical professionals do to help during the pandemic, during this time?
Yeah, that's so important and such a good question. I mean, I think that um, you know, following any guidance that the CDC is putting out, that's where I look, and the pandemic it's we're several months into it, but this is something new, and we're going to constantly be learning new things. So if the guidance changes, that's something I think people have to understand is they weren't wrong, or they're not it's not them making mistakes. It's we're learning more and more every day. We're learning more about treatment, we're learning more about prevention, we're learning more about face masks. I always like to use the example of there was a haircut place in Missouri where um, two of the hairstylists had COVID and they exposed 140 people, but everybody was wearing masks and not one person. It's on the Missouri Department of Health informational, website. I found it because I wanted to see for myself. And, so wearing masks is so important. Staying spaced out is so important. If you're going to the grocery store, stay away from other people, and the more we can prevent people, the more and more people who don't contract COVID, um, that I know, you see constant, I'm always seeing on social media, friends of mine saying, stay home, wear a mask, stay home, wear a mask. And it's such a simple thing, but it's really proving to work, and, um, you know, the, um, the vaccine hopefully will be out soon, which I know is probably another one of your questions. But, so in the meantime, though, we have to use the tools that we have, and we know that wearing masks work. We know social distancing works. We know washing your hands works. Not touching your eyes and your face works. And just being aware, and it's like, I know there's doubt with the CDC, and I know there's doubt with the guidance they provide, and that's the best we have, and like I said, this is something new, and it's something we're all learning together. And um, we really have to use the information that we have, and go with what has been proven, and you know just know that there is relief coming, hopefully. And if we just stick with this, I don't think anybody wants to be back in their homes, and just completely quarantine for another however many months. We're beyond that. We know now about masks, and we know, even that was guidance that changed. Don't we know we shouldn't wear masks now? Yes, we should wear masks, and we found, yes, they're effective. So wearing a mask, and just, remember that everybody is going through what you're going through. That would be the most helpful thing, for mankind. And like I said, we're all internalizing it. We're all feeling effects. We're all losing sleep. We're all stressed. We're anxious. You know, we're all feeling the effects. And to help the healthcare workers, the best thing to do is just be very careful and not get it. I mean, and that's of course not something you can always control, but just being mindful of your surroundings, your environment. If you want to see friends, stay spaced out. Outside dining is better than inside dining, and or takeout. Go have a picnic, go to a park. Take out, Uber Eats. I've started to do that a lot more, just because it's A, very easy, and B, it's much safer than going and sitting inside a restaurant. So
Yeah. So,
yeah.
you mentioned that we are in a surge right now, and Thanksgiving just happened. As a hospital administrator, do you feel like you're prepared for, I would hope that people were being safe during Thanksgiving, as safe as they could, but we might be in for something next, right?
Yeah, we could be. I mean, hard to say what was this surge. Halloween was maybe a month ago now, and I know that just different areas, and people just, they interpret the rules, and they interpret, what we should and shouldn't do differently. As far as being prepared, yeah, I think, a lot of the hospitals are prepared. This is several months in. I think that, places have PPE, and they're ready, and it's like we've done it. We've done it a few times, and we'll keep doing it, for as long as we need to do it. Um, but yeah, the surge definitely takes its toll, and different hospitals have different strategies, as far as staffing and expanding their units into other areas. And it's like, they ramp up and scale back as needed. And I think a lot of hospitals by now are getting the hang of it, the hang of this, and I hope there's enough PPE and everything. I haven't heard much about there being a shortage again. But I know that the paper towels and the toilet paper are flying off the shelves again. Um, so yeah, I mean, I think hospitals are unfortunately more and more prepared as this goes. I mean, fortunately they're prepared, but unfortunately, because this is still going on and we're surging up and down.
Right.
Um,
Well, I
but
know that there's
yeah.
places in the Midwest where they're just out of beds. So is that something
Mhm.
that you feel like is a concern in Orlando?
Yeah, in Orlando, no, I haven't heard much about that here. I know there are definitely communications with neighboring hospitals and resources that can be shared if one hospital is filling up. Um, one thing
What does one do as a hospital administrator if you're out of beds? Like what happens then?
I think you would call your neighboring and sister facilities and just see where you can transfer. It's like, one hospital system and the other hospital system. I think in that case, I personally haven't dealt with that, but I've heard that, there are places, they would communicate and be able to transfer, in Central Florida, for example, a couple of the big hospitals are Advent Health or Orlando Health, and they have multiple campuses. So if you know, I'm not familiar with the structure in places like the Midwest, but yeah, I mean, I know that's something the state watches closely. And relief, I've even heard of places setting up mobile ICUs that come. It's like a portable, a fort that they set up outside with hospital beds. So there are options, and I just hope that we don't have to get there, get to that point. I'm not sure what they're doing in the Midwest as far as if they have a bed shortage and how they're handling it, but I would um, I would imagine that all hands would be on deck. Who's well enough to go home. Start to discharge patients that are stable enough to go home, and what resources do you have in the community elsewhere would probably be the next thing after that. So.
And so you briefly mentioned the vaccine. What are your thoughts?
As someone who really just wants to believe it's going to work. I mean, the data's coming out and it's good data, but I will get it, as soon as I can. And, one of the doctors I follow online made a good point that, if we all get the vaccine and then there's something better that comes out down the road, um, it's likely that we could get a different vaccine in the future. He mentioned shingles as an example. There was one shingles vaccine in circulation, and then, um, you know, now it's like the new thing is to get this better shingles vaccine. Even if you had the old vaccine. So again, this is new, and we'll have to just. I mean, I truly believe that an effective vaccine is really the only way we're going to get back to what we know as normal. Once the majority of people are immune essentially, to the virus, and we can have gatherings, and the data will speak for itself. If the number of cases will hopefully start dropping, people will have the antibodies, and that will have to follow once we start vaccinating people. But from what they were saying is, healthcare workers could start to get their first vaccine in December, maybe January, and then follow up with the second shot, I think within a month. I think it's 14 to 21 days later. So as we start to roll that out over the next several months, the vaccine will, I believe, healthcare and, the most vulnerable populations, nursing homes, will start to get the vaccine, and then, higher risk populations. And over the next several months, hopefully we'll start to see improvement, in positivity rates and hospital bed usage. As those things start to come about, then we'll kind of know like, hey, all right, we did something right, you know. So, but yeah, I do plan on getting the vaccine as soon as I can get it. You know, I just really believe it's something that we can't just ignore, and we have, you know, like I said, if we, the more we can get the vaccine and the more people can be vaccinated and immune, the more we'll be back to normal, you know, and we'll see.
All right. Well, I know you're busy and you have a lot you're dealing with these days. I did have one last question for you. I'm just curious if there's like, lessons learned from this time during the pandemic, either personally or professionally, that you're taking with you into the future.
Yeah, I mean, I guess you just never know what's going to happen when, and you know, we have all these things planned out, and you know, it's like no one saw this coming, you know, so it's like you really just never know how or when things are going to change the way they have now, and you know, will this happen again? I hope not, you know, anytime in the near future, and if it does, maybe we'll be a little more prepared as far as the psychology behind what we have to do and what we have to endure, and it's like, you know, and like I said, you know, I think everybody is internalizing this in a lot of different ways, and just being aware of that, and you know, being aware of your surroundings when you're out and the people you're interacting with, or trying to, even though you're avoiding close contact, you know, people are all going through this for different reasons, and they're internalizing it for different reasons, and they have different concerns in their lives. And you know, like I said, it could be family, it could be friends, it could be their kids, it could be themselves. You know, I know some people are in the high risk group themselves, and nobody wants to get the vaccine, you know, nobody wants to get the virus, you know. And it's the stress and the anxiety, like I said, has been very real for everybody. And you know, when you encounter people, you know, it's easy to not remember that, you know. And I've seen people getting into tense situations just at the grocery store, you know,
Yeah.
we've been at it for a long time now, and we are, I hope, so close to the end. And yeah, I mean, it's just, you know, we have all these things that we wanted to do before COVID, and we had these people we wanted to see, and we had these places we wanted to go, and you know, and it's, I hate to sound cliche and say like live your life, but you know, once the veil is lifted, and we can start to get more normal, you know, it's just going to be so important to really to take those trips and see those friends and see that family, and do what you really want to do and what you've been wanting to do. You know, I have a lot of things kind of in the back of my mind that, you know, it's like I should have done this, and I should have visited this friend up north because they had a baby, and you know, here we are, can't do it right now, you know. But um yeah,
I like
when the
that.
time
It's like
comes.
we've all kind of had a near death experience in some way. Like there is like a mourning for this year.
Yes.
And oftentimes when you go through something like that, it's like it reminds you what's important and to live your life.
Yeah, I mean, there are the definitely the different stages of grief, and I think we're grieving, you know, and in this, you know, we're grieving for a lot of things. And it's, yeah, it's important to not lose sight of what's important, and um doing and seeing the people, you know, like doing the things you want to do, see the people you want to see. And but we've also learned you're a Zoom call away, you know, or you know, FaceTime. I don't think I've used FaceTime this much in my whole life, you know, as I have now, you know. So but yeah, I'm happy to be here. I'm happy to be on your show. I hope that you know, I hope everybody's hanging in there. I hope everybody's taking care of themselves. Everybody listening should really just find something nice to do for yourself. That was advice that was given to me last week, actually, and I did, and I was glad I did. And you know, we just got done with a long weekend and ready to rock again, you know. But take care of yourselves and take care of each other. That's the really the most important thing that anybody can do right now. And just be mindful and be considerate that we're all going through this and we are all feeling the effects. Um, yeah.
Well, Thank you, David, so much for joining us today. It's so good to see your face and
Yeah, it's great to see
your
you.
voice.
Thank you for having me. And I'm happy to just get my thoughts out there. This has been almost therapeutic for me too. So
Good.
yeah,
They'll win.
yeah, yeah, yeah.
And thank you also for the work that you're doing to help, keeping people healthy and getting them on the right track and saving lives.
Yeah, it's
It's
really
important.
such a pleasure. It's really such a pleasure. No matter how physically exhausted I am after a shift working, especially at the bedside, mentally it's almost recharging. It's rejuvenating to just feel, so it's fulfilling. It is, even if it's exhausting, it's at the same time it's very fulfilling. And I really take my hat off to the people who do this day in and day out. Like I said, I get to come here and sit at a desk for some of my time, and there are people who are doing every shift, on their feet 12 hours, um, you know, or longer, like several days back to back. And the people who are really living it, the Ari Rubensteins of the world who are getting deployed to different places, that's phenomenal to me, and I'm fortunate to do what I do, and I'm fortunate to work with the people I work with. Um, and I'm really just so proud of everybody and the way they've handled themselves and taking care of their patients, so. But I appreciate it. That's very sweet. Thank you.
Well,
Yeah.
you're a mensch. And and thank you everybody for joining us today. We'll see you next week and have a beautiful, safe, wonderful week. And Hanukkah's just around the corner, so there'll be more light in the world in the darkest time of the
There
year.
you go.